Good morning, everyone. Welcome to the D.C. office of the Hoover Institution. My name is Mike Franc, and I'm the director here, and honored to welcome you all. What we're doing today, in conjunction with the Conservative Reform Network, is one of a series of rollouts that CRN has been doing on various policy issues designed to address some of the core concerns in very important policy areas, such as today's topic, healthcare, and then go through an analysis of the nature of the problem and then offer some broad, and in some cases some specific, ideas for solutions to address these. One of the common themes that CRN has addressed over their work, as I've noticed, is thinking about the broad American middle class and some of the frustrations, the concerns, and the shortcomings that they've experienced in these policy areas in recent years and how to redress that. So today's healthcare. Healthcare, as you all know, is one of those vexing issues, and I just want to address one aspect of that. We often talk about the effort to repeal, to replace the Affordable Care Act, known as Obamacare, and it's been very frustrating. It's led to a lot of tensions in the center-right side of the political spectrum. And just one bit of historical context might help. I first heard from Senator Ben Sasse of Nebraska, and he pointed out that there are three kind of pivotal moments in the expansion of government in America in the last century. And it was the 1930s, New Deal, and mid-1960s with the onset of the Great Society, and then more recently in 2009, 2010, with passage of the Affordable Care Act, Franc, the stimulus, $1 trillion stimulus bill, and so on. And one thing in common for all three of those periods is that the Democratic Party controlled the White House, both chambers of the Congress, and has supermajority control in the U.S. Senate, and used that very unique situation to drive through some massive expansions of government, almost all of which have settled in and unfortunately remain with us. So that's part of the challenge everyone faces in talking about this stuff, and I think it's worthwhile to remember that 2009, 2010 was not an ordinary time in our democracy. So today, we have two wonderful and thoughtful panelists to address the healthcare reform issue and offer some ideas about where to go to resolve it. Our first speaker will be Grace Marie Turner, who's president of the Galen Institute, founded in 1995. She founded it. Grace Marie has been a prolific and engaged member of the center-right conservative reform effort on healthcare. She served in a number of capacities, which indicates the respect with which members of Congress on Capitol Hill and her peers in the healthcare field feel about her. She's been a member of the Long-Term Care Commission. She was, for 3 years, National Advisory Board, the Agency for Healthcare Research and Quality, on that. She was a member of the Medicaid Reform Commission. She's been widely published in just about every major newspaper and a lot of the journals that address these issues. She's co-author of a recent book, Why Obamacare is Wrong for America. She's been prolific also in appearing in the media, and she's a terrific friend as well. And our second speaker will be Jim Capretta. Jim is a senior fellow at the Ethics and Public Policy Center and a visiting fellow at AEI. He's also a member of the editorial board of Health Affairs, and his professional career indicates how much granular, on-the-ground knowledge and experience he has in the healthcare field. He was an associate director for human resource programs at the Office of Management and Budget for 3 years from 2001 to 2004. He served on the Senate Budget Committee as a senior policy analyst for 10 years throughout the 1990s. He's testified, I counted at least 6 congressional committees where he's testified in recent years, both budget committees, Ways and Means Committee, Government Reform and Oversight Committee, and the HELP Committee in the Senate. He's published, I was joking with him, if you print out his bio from the AEI website, it's something like 22 pages of articles in serious journals, in general publications like Weekly Standard, National Review. Talk about prolific, that's his middle name. And he's a great friend. And the last thing I'll say before we turn it over to Grace Marie is that part of the challenge sometimes that conservatives face in this area is a widespread sense that there's no real serious ideas out there to replace what we're complaining about. We know what we're against. We not know what we're for. I think the careers of our two speakers today belie that and indicate that there are a lot of people out there who have given a lot of thought to the principles that underlie a reform effort, and then even into the granular level, on-the-ground specifics. And the last point I'll make is that there's also this allegation, which really burns me, is that people center-right are analytical and all that, but they have no heart, they have no compassion. And anyone who knows these two, even for a little while, I think will quickly be dispelled of that. They have hearts, they care, they're in this field for all the right reasons, and I really admire both of them for that more than almost anything else. So please join me in welcoming Grace Marie. I think you're coming to the podium. Grace Marie Turner, thanks.
Good morning. Thank you all for coming. I really appreciate this wonderful turnout. It shows that healthcare is still relevant to those of us who care about this. And thank you, Mike, not only for your lovely introductions, but for this wonderful space, beautiful, beautiful space, and your work with the Hoover Institution. And especially want to thank Neil Bradley, Yuval Levin, Ramesh Panuru, my editors for this piece, and April Panuru, who without whom nothing happens, I think. They are making really an important contribution with the Room to Grow series with others at the Conservative Reform Network, and really helping to provide a roadmap for reform and helping candidates for offices at all levels to understand the fundamental principles of a conservative reform agenda that's realistic in the current world. I'm very grateful for being included in this project, so thank you very much, Neil, and your team. On healthcare, we too often hear, even from people on our side, that conservatives don't have a plan. And yet virtually every center-right think tank has a plan, including the Hoover institutions, Scott Atlas, most recently Jim Capretta and his team at the American Enterprise Institute, John Goodman, who's here, many others have put together detailed plans for reform. Members of Congress have offered detailed plans and even legislation, including Senators Burr and Hatch, Chairman Upton, who will be joining us shortly, Chairman Price, Republican Study Committee, and Speaker Ryan has appointed a task force to pull together the key committee chairmen with jurisdiction over this issue to come up with a consensus plan that he hopes to release this summer. And most of the serious Republican presidential candidates have offered either detailed plans or the pillars of reform to talk about what they would do. So why don't we hear much about this? I'd argue it's because conservatives overwhelmingly agree on key principles and pillars for reform and for a replace plan. Healthcare has been virtually absent from the Republican presidential primary conversation because candidates find it hard to differentiate themselves from each other based upon their positions on health reform. All of them start with the premise of replacing Obamacare. The inappropriately named Affordable Care Act is clearly failing to fulfill its many promises. Americans are increasingly understanding in a very personal way the costs of government control over healthcare to their lives and their choices. They see that government giving them choices gives them many fewer of the choices that they really want, and that they pay a very high price for government's intervention in the health sector. But for all the damage that Obamacare has done, there is a silver lining. It's awakened Americans about the inadequacies and costs of a government-centric healthcare system. And this awakening, I think, has opened a significant opportunity for conservatives by making the most of the opportunity. But making the most of this opportunity requires convincing Americans we do have a solid replacement plan and series of reform proposals. Americans are not wanting to see another sweeping reform plan. they realize the damage and the uncertainty that this has caused. And frankly, they don't trust Republicans to be able to come up with health reform, I think, any more than they now see that the plan that the liberals have come up with is really not meeting their needs. But that doesn't mean that they simply want to undo Obamacare. They don't want to revert to the system that we had before. Tens of billions of dollars have been invested in restructuring our health system around this law by companies and individuals inside and outside the health sector that have to follow the law, unlike many cases this administration. And the pre-Obamacare health sector doesn't any longer exist. We must evolve from where we are to a new transformative system. So we need to convey our vision of a patient-centered reform, but assure them that we will proceed carefully. I talk in my piece about the common pillars of reform and the ideas and concepts around which they're organized. People should receive subsidies now should not lose them, while a better, more efficient, more consumer-centric system is developed and evolves. There's also widespread agreement that government support should help the most vulnerable, who have few other options for care and coverage. We need a modernized safety net, though, that supports work and investment and innovation and individual freedom. And we have also more creative ways of solving the problems of pre-existing conditions and uninsurance than the heavy-handed government mandates and tens of thousands of pages of government regulation that we have from Obamacare. So the foundation of replace must be truly empowering consumers in a competitive market while providing security and assistance for those in greatest need. Conservatives have long supported tax fairness as a fundamental principle of health reform. Addressing and equalizing the tax treatment of health insurance is always going to be central to conservative reform proposals. If consumers are empowered to make their own choices with balanced financial incentives, transparent prices, flexibility regarding insurance and benefits, and then genuine competition, not Obamacare's fake choices, then we believe the market would flourish and give people countless options that we cannot even imagine today. So in my piece, I talk about 4 key policy principles that are really the pillars of conservative reform, and then some of the key ideas behind those proposals. 4 of them: security and freedom through health insurance choices, state flexibility, modernizing Medicare because of its central role in organizing the health sector, and then fostering innovation. All of them are crucial to a reformed health sector. So, security and freedom through health insurance choices. Consumers want and need more control over their health spending, while plans and providers need to be liberated to compete on cost and quality in response to these consumer demands. The federal government has for many years supported the purchase of health insurance for people who fall into 2 groups. Lower income people, making in many states up to twice the federal poverty level of nearly $50,000 a year for a family of 4, who may be eligible for Medicaid or the state children's health insurance program. Also, people with higher incomes who get generous health insurance at work, the cost of which has been excluded from their federal taxes. Both groups have typically received comprehensive health coverage, with the case of Medicare, coverage, not necessarily care, at a discount with generous help from taxpayers. But other Americans have been left behind. With Obamacare was sold as a way of expanding coverage to provide more help to those in the middle class who have left out of this system. But the system now is incredibly stacked against these people, middle-income families who are paying for the law's redistribution. These are families that have had their policies canceled. They've been forced to buy coverage and benefits they don't want. They've been hit with higher cost sharing requirements and restrictive networks, and all for the privilege of also paying higher premiums and getting little or no tax relief. A fairer, simpler, more rational approach to tax breaks for health insurance must be part of a conservative health reform plan. Conservatives have long debated whether a tax credit or a tax deduction should be offered to support the purchase of health insurance, with an endless number of very creative variations. This proposal in the Room to Grow plan we are releasing today would provide a refundable credit for individuals who were not offered health insurance at work. People would be able to apply the credit toward any health insurance policy approved by a state, including policies free of expensive mandates, regulations, and benefit requirements to the extent the state determines. States would regain their authority in regulating health insurance because they are closer to both their markets and their citizens. Making this credit available only to Americans who don't have the option of health insurance at work would preserve the employer market as we move and evolve to a system that is more equal and fair for everyone involved in purchasing health insurance. But for the credit to work effectively and enable this gradual transformation of the health system toward a more functional market, a number of more modest reforms will be necessary. Continuous coverage protection. Jim perhaps can talk more about this. People needing to know they won't lose their coverage if they lose their jobs or get sick, and how this would work. Renewability and portability is really crucial. People should be able to own and keep their policies from year to year and be able to switch to other carriers if they choose without facing new underwriting. Flexibility. Americans should be able to choose health coverage and care that best meets their needs, free from the straitjacket of benefits that Obamacare says are essential, but often ignore what consumers actually prefer. And transparency, crucial to a functional market of informed consumers so that they have the information they need to make good choices about prices and about care and quality. With greater price transparency, more people will see the benefit of investing in catastrophic coverage through health savings accounts and other creative mechanisms to make sure they get insurance, but also have the financial incentives to really regulate and monitor their own spending. Second principle, state flexibility. States, rather than the federal government, should have control over regulation of health insurance for reasons I just said. They should be able to approve a broad range of health insurance policies and regulatory structures, giving people more options for coverage. States also should be liberated to the extent possible from the numerous, complex, and often conflicting relationships between a variety of federal funding streams. You probably saw the op-ed in the Washington Post last week by former Speaker Newt Gingrich and former Senate Majority Leader Tom Daschle talking about the state flexibility. They're talking about it through the vehicle of Section 1332 of the Affordable Care Act, but they also were recommending that states have the authority to be able to merge income streams from refundable tax credits, from Medicaid, and from any support that they may provide into a single platform to help individuals in obtaining coverage. Modernizing Medicare. It's impossible to ignore Medicare in an overall reform plan. It covers nearly 54 million people, spends more than $600 billion a year, and it must be front and center. And if Medicare is going to be preserved for future generations and even for current retirees, spending must be controlled and red tape untangled as much as possible to give more choices to seniors among truly competing coverage options. Medicare Advantage and Part D really show the way. There's a wonderful piece I think you have here that Neil Bradley wrote on the Medicare prescription drug program, a model for broader health reform. We have seen what works. We have a program that gives seniors more choice, relies on genuine competition in the marketplace, and it is coming in at half the price both in premiums and in spending, than was anticipated when this benefit plan passed. There are strong safety net protections for lower income seniors, and the plans compete on choices, and lower costs are driven not by price controls and government regulations and government dictates, but by consumers operating in a truly competitive market. Medicare Advantage should become the default form of Medicare coverage, and fee-for-service Medicare could then be offered as one option in a Medicare Advantage menu, competing on a level playing field with private coverage options. I think Chairman Upton is obviously going to be talking with us much more about his innovative plan there he is, what perfect timing, as I come to this part of my point. In addition to controlling prices and letting markets respond to people's preferences, health markets must be able to continue to innovate. If we do not have continued progress and innovation both in health insurance structures, in care delivery structures, and in pharmaceuticals, then we will not have the quality health care in the 21st century that is indeed possible. We are at the cusp, I want him to hear this, we are at the cusp of a transformative era in medical technologies that will make today's care delivery and today's care look primitive by comparison. Innovations in biopharmaceuticals, for example, can use a patient's own immune system to fight cancer. Breakthrough treatments for lung cancer and melanoma, and even cures for once deadly diseases have already been approved by the FDA. Dozens more are in the pipeline. And these new medicines will and are changing lives and dramatically increasing long-term survival. The House of Representatives has passed the 21st Century Cures Act, that'll get his attention, under the leadership of Chairman Fred Upton, with strong bipartisan support. The legislation is designed to speed up the frustrating and time-consuming, extremely expensive conventional drug approval process. New technologies also can provide consumers with information and choices to make the smart and efficient choices that our financing system would support. Thousands of walk-in clinics have been opened in pharmacies and big box stores around the country. Countless other delivery reforms would certainly emerge in a healthcare financing system with greater flexibility and more focus on what consumers genuinely want. At the federal level, significant streamlining of the FDA process is essential. At the state and local levels, officials must be pressed to drop protectionist barriers that impede economic progress and look at the expensive status quo that blocks innovative solutions in medical care delivery, such as physician-owned hospitals, telemedicine, and consumer-friendly clinics. While technology and innovation are embraced in other sectors of our economy, for some reason they're viewed with suspicion and even hostility in the health sector. That is a vestige, Chairman Upton, welcome, of a paternalistic, rule-driven, price-controlled system that constantly clashes with consumer demands and the inevitability of change in an information age economy. So, to conclude, what's the common theme? What's the one underlying theme, the unifying theory of all of these plans? I would argue that it's a defined contribution. You'll see that in so many of the conservative reform plans. Defined contribution means that the money follows the person, whether it's in Medicaid, state children's health insurance program, Medicare, employer-based health insurance, any tax support that the federal government goes to the individual so that they then are empowered with financial resources to make more choices of the kind of coverage that works for them and their families. And our job is to explain to a young mother how these plans will be able to pick, how these plans and our proposals will allow her to be able to pick the financial arrangement and the insurance coverage that work for her and her family. to help a small business owner see that this is a pathway toward being able to spend her time running her business, but also provide the care and the coverage that many of their employees would want. Also, to protect Medicare, we've got to make sure seniors know that injecting more consumer choice into the program is going to save the program and give them more options that they want and need. And we have to make sure that the most vulnerable understand we are on their side and we are trying to protect these programs for them so that they're able to get the care they need without competing with so many other people who may have other options for care and coverage. If consumers are empowered to make their own choices with better incentives, transparent prices, and flexibility and benefits, then genuine competition would flourish. I would like now to turn the platform over to Jim Capretta to talk about many, I'm sorry.
Yeah, this way. For those who came in a little bit late, you can sit in these front row seats. There's 5 seats.
I thought I'd go ahead and just stand up over here and for my remarks. Thank you to Mike for the very nice and generous introduction, and to Hoover and the Conservative Reform Network for putting on this event today. I'm very pleased to be a part of it. Great to have Chairman Upton here as well. There's a great irony at the heart of the healthcare discussion, and it's as follows. It's that the proponents of the Affordable Care Act, if you listen to the presentations they make on the law and how it works over time, actually don't really believe very much in market forces if you listen to them. And certainly if you listen to the political rhetoric going on in the campaign trail these days, I think you would hear very much from the candidates for the Democratic nomination that the solution to the healthcare issue from their perspective is very much a government-centric approach, that the government needs to regulate it, that fairness and quality for everyone and access for everyone requires very much that the government be at the center of decision-making processes. The irony, however, is that the president himself and many of the authors of the Affordable Care Act say that the law itself was built on market principles. They make that argument, that the law is based on consumer choice in the exchanges, there's competition amongst the insurance plans, and that why would anybody oppose this because it's building off of conservative principles. At least that's the argument they sometimes will make. And so I think the question sometimes I have to myself, and I'm sure others might have, is, well, which is it? Do we believe that really a market-driven, consumer-driven approach is the better way to go? Or do we believe that actually we really want the government to kind of run the thing as it does in many other countries? And I think there's that contradiction on the other side leads to all kinds of cognitive dissonance and funny things happening in the law itself. Yes, there is an element of consumer choice, of course, in the law that passed in 2010, but it's built mainly around a massive move of power and authority from individuals, employers, consumers, states, to the federal government. If you actually read the law, which obviously many people have not, it's got a lot of secretary shalls in it. The Secretary of HHS shall do this and that and many things. And my own observation is they've exercised about 20% of that power so far, and they got a long way to go. So they can really run the entire health system out of HHS. And if you read the stories around the health system that have gone on in the last few months, almost every story begins with the health sector waiting to hear about the latest pronouncement from HHS on any number of different aspects of the health system. Insurance regulation, what the payment rates are going to be, what Medicare will do around accountable care organizations and bundled payments for the hospital systems. Everybody's waiting for HHS to issue the next set of instructions. And so I think that is really the path we're on. We may not get all the way to Senator Sanders' view in a 5 years' time, but we're heading in his direction, okay? And so I think the exercise that I've been undertaking over the last year is to work with some colleagues around trying to design something that is a realistic, practical, but very much real market-driven approach to healthcare. Not one that sort of pays lip service to it, but then really tries to just regulate it through the federal government and HHS. And that's what I want to spend just a few minutes talking about today before we get to the most interesting part of the morning, which is really Chairman Upton. So I won't be very long. I know we were all waiting for him. The report we worked on, I'll just hold it up here, is Improving Health and Healthcare, an Agenda for Reform. There are a number of colleagues on it that I worked with. And it starts with a series of principles, but we were very much focused on trying to get beyond just generalities, but actually get into how it would work in the programs that really affect where people get health care in the United States. And so it covers much of the ground that we've already heard about this morning. It covers the employer-based system. It covers replacement of the Affordable Care Act. It covers Medicare and Medicaid and many other things. You can read the full report for yourselves, but I thought I would just point out some highlights and main policy decisions that we made along the way that I think are very important to moving toward a truly market-driven system across the board, across all platforms and every aspect. Let me sit back one moment here before we get into that, which is to make one more articulation of why do we do this. The reason to do it is because a truly market-driven system with consumers all over the country making choices for themselves is the best way to assure over the long run high-quality health care, innovation, breakthroughs, better medicine, longer lives, better health. The whole point of this is to have better health for the American public. It's not because people want profit-making in insurance companies or big institutions or hospitals or doctors making a lot of money. Despite what the opposition will say, that is not the point. The point is better health, better breakthroughs, better medicine, better trained physicians, all across the board for the American people. So that's the reason why you want a system like this. If you regulate it and you centrally control it, the ability to innovate, create new pathways for people to get care is very much restricted. You're waiting always on the central government to make decisions. You can observe that all over the world. Many of those international systems have some strengths. I don't deny that. But they also have the weakness of being very rigid, lack of innovation. They often look to the United States for the latest breakthroughs. That's the truth. So, what do we want to do? We want to replace the Affordable Care Act. We want to replace it with a system that is much more decentralized and consumer-driven. And there's a couple of aspects that are critical to making that happen. One is we don't believe we should start right away with replacing the entire employer-based health insurance system. That is a little bit controversial among some of my colleagues and so on, but there's 155 million people in the United States that get health insurance through their employer. I don't believe the amount of disruption that would occur if you upended all of that through a massive change in the tax treatment of employer health care is desirable politically. I think it would be too much change too fast. So what we propose is to provide an upper limit on the tax preference for employer-paid health care to provide some cost incentives. This would replace the Cadillac tax, but generally leave the employer-based system in place. And then for anyone who's outside the employer-based system, we provide a uniform refundable tax credit to people to buy health insurance on their own in the marketplace, regulated by the states, without all of the restrictions that occur in the ACA around benefit requirements and where you have to secure insurance. States would be put much more back into the driver's seat of regulating the products that consumers could buy. Attached to that is a major Medicaid reform. Medicaid is really providing services to two populations. It's providing services to disabled and elderly patients, and it's providing health insurance in a sense to working age people and their children, and many also childless adults. We need to separate those two groups into two parts of Medicaid and start treating them as separate programs, because they really are separate programs with very different functions. In this proposal, we recommend making per person payments to the states to take care of those two populations separately. And the population that would be the working age and their children, we would integrate them into a tax credit system for health insurance, so that they would be buying the same products that other working age people are buying for their families and their children. So that component of Medicaid would be much more integrated into mainstream insurance, and states would have great flexibility with how to do that. They would also have great flexibility with trying to improve, through a lot of different mechanisms, the care for those on Medicaid who are disabled and elderly. On the Medicare side, we also believe that Medicare can move much more toward a consumer-driven system, building on, as was mentioned, the Part D model, the prescription drug model. That would involve giving the beneficiaries much more freedom to choose their various options and the financial incentive to do so. Let me just mention one other area of Medicare that deserves special attention. During this administration, they've pushed a concept called accountable care organizations. That is essentially managed care without the insurance plan. They would like physicians and hospitals to form these organizations and place the beneficiary population into them to have their care managed by a new structure, and they're pushing this very hard. A couple of interesting aspects of how they've done this. It's called the Medicare Shared Savings Program, MSSP, but the savings is shared not with the beneficiary. The savings is shared between the government and the hospitals and the doctors that are participating in the ACOs. We recommend in this proposal that we have an integrated care option available for people in the Medicare program, but it ought to be something the beneficiaries select overtly, and they aren't placed into it by the federal government. And when they do so, if it's less expensive than the current Medicare structure, they ought to get a break on their premium, reflecting the fact that they've selected a more cost-conscious option. We make many other recommendations in the Medicare area regarding Medigap reform, and updating and modernizing the benefit package, which was written in the 1960s and is completely disconnected from modern health insurance design. Another major feature of this proposal is promotion of lifetime enrollment and health savings accounts. As I indicated at the beginning in my remarks, the point of this exercise is to build into American healthcare across the board stronger incentives for everyone to participate, making choices about the kind of healthcare that they would like to get. And the combination of higher deductible health insurance with an HSA where people are building assets is a very effective way to put the right combination together. People have insurance against expensive medical events, and then they also have the ability to use their account to purchase services below the point at which their insurance is covering their expenses. That gives them a lot of cost consciousness in their choices, as well as financial protection. Now, it's sometimes argued that, well, this whole HSA business is really nonsense because, most spending in the United States is for very expensive medical events. And of course, that is true. When someone has a major medical event, that's when the tab is really going to go up a lot. And also people that have multiple chronic conditions have high expenses every year. And so they're always going to cross this deductible line and have, in a sense, catastrophic annual expenses. So what do we do about that? Well, or the argument is often made, can really we expect any of that to be subject to market pressures and consumer choice? Well, remember, when someone picks an insurance system, they don't necessarily only pick the financial transactions that are involved in it. They may be picking actually a delivery system for the services they get. I mean, the whole point of Kaiser Permanente and other HMOs is to offer people insurance protection plus a care delivery structure that is less expensive because it's integrated than other care options. And that means when they have a major medical expense, if they have cancer or they have a traumatic injury of some sort, that integrated care system presumably can provide higher quality care at a lower cost than unmanaged services. And so if we allow people who are in HSAs with high deductible insurance to buy into those kinds of integrated care options with their own money, they will do so. If it's higher quality and lower premiums and better for the people that are enrolled in it, of course a market will naturally push people in that kind of direction. The only change we need to make is to make sure that HSAs can be used to purchase that kind of an integrated care option and not just used for fee-for-service care as it generally is today. And so we make that recommendation in here as well, that we need to make the ability for consumers to pick where and how they get their care more open than it is through the current structure, allow them to use their HSA money to actually buy into managed care options. We make a number of other recommendations in this plan. We focus on long-term budgetary costs. We focus on doing things to make sure that the entitlement structure of the United States is affordable over time. As it stands now under the Affordable Care Act and the current budget baseline, we're headed toward major, massive fiscal dislocation. And so a big element of this proposal is to set the country on a better course for its commitments and obligations over the long run. And there are a lot of recommendations in here that would improve that long-run outlook. But the main focus, as I started off with, is on building a genuine market system with the government providing oversight over it. If you read our plan, you'll see that it's not something where there is absolutely no government oversight of the marketplace. There is. But it's done in a way where the consumer really can have the freedom to make choices for themselves. And when we do that all across the country, every citizen making some responsible decisions for themselves about how and where to get health care, the system overall will improve for everyone. That's the beauty of a market. I think I'll stop here and turn the program back over to Mike.
Thanks, Jim and Grace Marie. We're going to, I think, stop the, have no questions just now, but we're going to turn to remarks from Chairman Upton so we can get that started. And let me introduce Neil Bradley. I neglected to do that earlier. Neil, a lot of coaches say in sports you can't teach speed. Well, Neil spent nearly 20 years at the highest levels working as a staffer on the House side. Oh, okay. And you can't teach what the kind of skills Neil brought to those tasks over the years. It's always been a pleasure working alongside him and around him. And the Conservative Reform Network is really honored and privileged to have him as one of their core members of their leadership team. So Neil, welcome. This is your first time speaking at a Hoover event, I believe. Yeah. So let me welcome you to Hoover in that official capacity. And you can now introduce Chairman Fred Upton.
First, let me ask you all to join me in saying thanks to Jim and Grace Marie for their remarks. And Mike Franc for hosting us in this incredible facility. Since he got this job, I've been trying to figure out ways to do events here because it is such a wonderful place. So the Hoover Institution now has a facility and a Washington director that matches its well-earned reputation in terms of conservative leadership. It's my honor on behalf of the Conservative Reform Network to introduce a man who needs no introduction in this room. Fred Upton is the congressman from Michigan's 6th Congressional District. He is the chairman of the powerful Energy and Commerce Committee, and you all know him very well. I would be negligent, however, if I didn't make 2 brief points before turning the floor over to Chairman Upton. First, Chairman Upton is someone who knows Fred. That's another great thing about Chairman Upton. Fred is someone who knows how to move the ball forward and get things done. In politics today, there's a lot of talk about vision, and vision is incredibly important. But as the old saying goes, vision without execution is just hallucination. And Fred Upton is someone who's figured out how to match a vision for conservative policies and reforms with execution. And that's what really makes the difference. So whether it's energy policy, telecommunications, or healthcare, even in a divided, gridlocked Washington, he's managed to get the Energy and Commerce Committee and its members and the House of Representatives constantly moving the ball in the right direction. The second and perhaps most important point is that Fred understands that healthcare is really about people. This is something I first learned from John Shadegg, former Congressman from Arizona, who's here today. But that frankly, other than Mr. Shadegg and Chairman Upton, I feel a lot of Republicans and conservatives don't understand all too well. When we Republicans and conservatives talk about health care, we often sound like insurance adjusters or worse, actuaries. That's not the way the American people think about health care. When they think about health care, what they want to know is if my child gets sick, are they going to get the care they need? If my mom or my dad or my spouse gets cancer, are they going to get the best care, the most advanced care humanly possible? Is there a chance that they're going to get cured? And that's why, for my money, there is no more important initiative in Congress today than the 21st Century Cures Initiative. It is what healthcare is supposed to be about. It's about cures. It's about binding up our wounds. It's a vision of where we want healthcare to go. We've heard a lot about that vision, including most recently from the President in the State of the Union. But what folks who believe in this understand is that Chairman Upton not only has had the vision, but he spent the past couple of years working to figure out how to execute on that vision of cures. And the result was an overwhelming bipartisan passage of the 21st Century Cures Bill that offers promise to millions of Americans. Knowing that we need that same kind of vision and ability to execute when it comes to replacing Obamacare, there's no one I can think better to address us this morning on that topic than Chairman Fred Upton.
Well, thanks. It is a delight to be here. Neil has been a good friend, a personal friend, as well as a professional friend, but I have to say that there's no way I could be where I am, whether it be leading cures or looking at the replacement of Obamacare, without not only very talented members on our side, and we really have the cream of the crop. They go through a real gauntlet to get on the committee. I confessed yesterday I was up in Buffalo, New York, helping Chris Collins on a number of different events, and they asked how Chris got on the committee. I said, well, he passed the first test. I said, what was that? So we have a little test, and some members do fail, and it doesn't happen. They don't get on the committee. He said, well, what's the first thing? What's the first key in the door? I said, well, they have to like dogs. I have 4 offices. Actually 5 if you count my committee office, and all 5 allow dogs. And if you're not friendly with a dog, and I do have a little thing of dog biscuits that everybody have, but I said if you're not friendly with that, with Bugsy coming in or Henry back home or whatever, you're not going to get the first base. But we have great members on our committee, really on both sides. But we have a real talent pool. But we also have an outstanding staff. Gary Andres has been my personal friend, but leader on the committee staff all 5 years that I've been chairman, and nothing happens that the two of us aren't in agreement on. But we have such a crew on each of the subcommittees, making sure that the trains get to the right station at the right time. So without them, we would be in trouble. Certainly I would. But Neil's been a good friend in lots of different ways. I was on the super committee a lot of years ago, so we spent a lot of time together and trying to get an agreement. But, I came early for a reason. I wanted to hear the panel. I told Mike I wanted to listen. And part of my job is listening. And, Mike and Jim and certainly Grace Marie, I mean, you've been outstanding. I'm literally on the same page. The bit that I heard, I was here for about a half hour. Parking's a little difficult outside, but we're all on the same page, and I'm not going to, I could have easily sat with the 3 of them, and we would have all been in conjunction as we move forward. But I got a couple of interesting things and different position itself that I'm in, but we do want to listen. We want to get your ideas. We want to get your thoughts. We're going to be reaching out in the next couple of months because While Obamacare became law nearly 6 years ago, we are still talking about it today because it's not popular, it's not working, and frankly, it's not going to stand the test of time. It just isn't. And while the media may sometimes focus on the politics of Obamacare, or how many times you have to vote on it, all those different things, we all know that the impacts of the law are very personal. Whether I was in Buffalo yesterday, in New York, or certainly in my state, in my district, looking at my mail, my email, and constituents from at home, people all across the country have truly suffered from lots of broken promises, resulting in, for sure, rising costs, fewer choices, lost coverage, and a real despair in terms of where the nation is heading. You saw if you watched the election results last night, 9 out of 10 Republicans in New Hampshire were upset about Washington. Didn't matter. And this is an overriding concern, Obamacare. And on the Democratic side, I want to say it was 6 out of 10. So they know how this law impacts their own lives, and they're very, very frustrated and ready for change. We know that Washington doesn't always know best, that is for sure. And we are truly seeing the perils of a one-size-fits-all policy constructed on truly obsolete ideas. And God help us, I watched again last night, God help us if somehow Bernie Sanders became our president. He talked about the single payer. Not even Barack Obama supports single payer. So, this election in November is going to be really important. So every one of us in this room knows that we can do better. And I know that's why we're all here, because you want to see us do better. And you do have a role, because as the panel discussed, there's room to grow. We need a fresh, forward-looking approach to healthcare, one that restores the focus back on patients. Recently, the House and Senate Republicans took an important step towards being able to replace Obamacare. We actually got a bill to the president's desk for the first time. Would have repealed the law. Importantly, it would have given Congress the time to enact real solutions focused on growing patient choice, improving patient care, lowering costs, promoting bottom-up 21st century healthcare innovation, providing states like Michigan a lot more flexibility. The exercise was important. We said we were going to do it. It was important that we finally got a bill to the president's desk, because not only demonstrated our resolve, but it also kept our commitment. It also road-tested the legislative path to replace Obamacare under a Republican president, if we can get to that stage next year. So if a Republican president is sworn into office in only 11 months, we are going to be ready. That is the challenge that Speaker Ryan put before us. And we're going to be ready for really 2 big reasons. First, that there will be a consensus that I think is emerging among Republicans on how to replace Obamacare. From the outlines of policy proposals on the presidential campaign trail, and we're working on those to present to our candidate, to ideas put forward by think tanks, and certainly in this room, and Hoover Institute has been terrific. John Cogan was one of my very best friends. Of course, he's with the Hoover Institute based in California, but his office was literally around the hall from mine when I worked for President Reagan back in the early 80s. Those policy proposals advanced by leading Republican members of the House or Senate, I'm encouraged to see a lot of common ground on the approach. There's an increasingly broadening agreement that any viable Republican replace plan has to include a number of things. Got to reduce costs, increase choices, more transparency and competition. We have to help lower income Americans, the most vulnerable, through some form of targeted assistance. We have to modernize Medicaid. Instead of trapping people, we have to modernize it by capping expenditures and giving states improved flexibilities for success. And we have to unwind Washington's takeover of health care by giving control over the insurance markets to consumers and states. I'm glad to see John Shattuck sitting in the back, because he advanced the first legislative proposal that others have stolen, including me, that allow folks to literally shop across state lines. That was John's bill in the committee, and he laid that groundwork, and it's got to be part of the equation. We have to help Americans with pre-existing conditions, that's for sure, with real access to care, and I also think we need to expand HSAs. Again, put that personal approach that's on there. And so there's a lot of good ideas out there. I'm partial to a degree, I think, to the common sense plan that Senator Burr and Hatch and I outlined, the Patient Care Act. Under this act, we replace the federal mandates with the freedoms for Americans to pick the plan that they want. Instead of forcing Americans to buy a Washington-approved coverage, we empower the American people to make the best health care choices for both themselves and their families. We reform the insurance market in a sustainable manner that still protects consumers so that no one can be denied coverage based on a pre-existing condition or face a lifetime limit or have an insurance company choose not to renew their plan. Under our proposal, Obamacare's labyrinth of federal benefit mandates, rating restrictions, and complex tax subsidy structures are gone, or just erased like an Etch-a-Sketch. The individual mandate tax and employer mandate are gone also. To help put affordable coverage within reach of vulnerable consumers, we provide an age-adjusted, targeted, refundable tax credit for the most vulnerable that buy health care coverage or health care services of their choosing. The most vulnerable Americans covered under Medicaid today, and taxpayers paying for that program, would also benefit from the reforms in the Patient Care Act. Our proposal improves Medicaid's financing and management. Federal spending would be capped in most cases, while governors could use the work requirements, consumer-directed accounts, other popular management tools to make the program more fair, efficient, and accountable for everyone who depends on it. We also need to promote a healthcare system that fosters innovation to bring cures and new therapies to patients faster. That's why we work so hard. Neil referenced this in his remarks, to advance 21st century cures, something where we in the House, our committee, listened to all of the stakeholders for literally more than 2 years. In fact, Henry Waxman was angry that he wasn't part of it, but we didn't have enough time. We knew that it was going to bleed into this Congress. We couldn't start it last 3 years ago and finish. So Diana DeGette and Frank Pallone, myself, we advanced this bill 51-0 in committee, and we passed it with 344 votes on the House floor. So what does this do? Well, it expedites the approval of drugs and devices, and I have to say, my family is no different than anybody else's. My wife has lupus. Mom's a cancer survivor. My dad has diabetes. My uncle died of Parkinson's, lived across the street. We got to find the cures for these. I brought some of my team. I did an event in Ann Arbor on Friday met with the Michigan Med School. Some of the top researchers were there, and I can remember being there in the early 90s, I want to say, 94, 95, about the time that John McCain and myself led the charge to double the money for the NIH. And I met the researcher, who's still there, I think, who identified the breast cancer gene. And he got a small NIH grant, and he didn't know, as I talked to him, he didn't know why his project was picked over somebody else's. But it worked. And today, as we sat down with the NIH, the average age now for the first NIH scientist is not until he or she gets to age 42. Well, who's going to spend and owe hundreds of thousands of medical school debt, graduate at 27 or 28 years old, and hope that maybe in 14 years I'll get my first health research grant? So we changed that. It's one of the many things that we did in this bill. But the NIH, and I was out at MD Anderson, they get 1 out of 3 NIH grants there. I mean, it's terrific to see some of the things that they're doing, whether on cancer or, all the, to actually walk in and see some of these operations taking place. It's just incredible. But this bill is an actual solution also to the drug pricing issue that's increasingly being discussed in every healthcare circle. Reducing the cost of bringing down the price of drugs and devices. It's going to help lower the prices for the patients. It's going to represent a stark contrast to the tired idea of just bringing in price controls, whereas we know if you do that, you may just lose the market altogether. You'll never discover the cures, or they'll go overseas. They already are. And, of course, so do the jobs and so do the patients. I met with a guy last couple of weeks, and they've got a wonderful product. It's not in stage 3 trials here. It's overseas. It's in New Zealand, in Australia. I want to say it's New Zealand. They couldn't get it done here. And it's a MS drug where it actually reverses, stops and then reverses MS for probably a period of 6 months. Well, maybe you didn't need that walker last September. So why isn't it being done here? Because the process is just much longer. You know, they spend hundreds of millions of dollars trying to get these drugs to market. So unleashing the promise of science and medical breakthroughs by eliminating government barriers to cures and treatments has got to be part of the solution. And really good news, just yesterday, Senator Alexander began to mark up pieces of our bill, and we're very encouraged that we can actually get a bill to the president, we think, if everything works right, maybe by Memorial Day. But we got to be part of that solution, because we know that it'll also help address our looming entitlement challenges. Remember, by 2050, Medicare will be spending more than $1 trillion a year on Alzheimer's. So anything that we spend less than that to find a cure, the better off we are all going to be for plenty of reasons. But the real reason, the second big reason that we're going to replace Obamacare in 2017, we got a speaker, Paul Ryan. He's committed not only to getting the big idea right, but also getting the process right. So he's outlined a process in the House for the 3 big chairmen, Brady, Klein, Price, and me, Ways and Means, Budget, Workforce, Education, Workforce, Energy, and Commerce. We are now heading a conference task force, all that I needed. That's going to work towards an agreement on how can we replace Obamacare and really put health care entitlements on a sustainable path. We met last week. We'll be meeting again shortly. We're going to have a full meeting with our Republican conference on Friday to talk the overall vision of where each one of these task forces are going to go. But Speaker Ryan's basic vision is this: go big and go bold. The chairman, our group, will lead a process that A, highlights the problems with Obamacare. We already know that. 2, engages every member of our conference to get their ideas about how to better replace Obamacare, and work to bring all the ideas together in one unified legislative product. We're also going to be listening to all of the outside groups as well. No doubt, a big undertaking. But we got a lot of good ideas from lots of our members on and off the committees, and we're going to do our best to go as far through the process as we can. The goal is to produce a product that is conservative, credible, has a consensus support from our entire conference, and in the next couple of months, American people will see a specific policy on paper of our vision for health care. Expect hearings and discussions, certainly at Energy and Commerce Committee, but also throughout the House. More importantly, the time frame is also going to give Republicans a mandate to act. We've started the process. We're going to need your ideas as well, and engagement in the days ahead. So let me close with this. Certainly, any of the solutions that are offered by my Republican colleagues in Congress are better than Obamacare, any of them. They all shine a spotlight on a better vision for health care, one focused on patients, families, doctors, innovation. Obamacare's government-centered premise is not new. The outdated ideas in Obamacare have failed people time and time again. Sadly, many of the predictions and warnings that we made about the law have come to pass. And still, there are tens of millions with no coverage. So for the sake of our freedom and our opportunity, for the sake of the economy and the federal budget, something we all care about, the public deserves a fresh-looking approach that embraces 21st century innovation. We are going to make it happen. So I look forward to your input, ability to be here, and again, you got the best. These three I've listened to a long time, really good friends, and